So the topic to be discussed in this video is atelectasis. Let's see what is atelectasis first. Whenever you hear the word as atelectasis, you have to get one word in your mind, that is collapse. There is going to be collapse in the lungs. In what lungs? In a previously inflated lungs. The word is very important. In a previously inflated lungs, there is going to be collapse. Like see here, when there is a lung, it will be inflated normally. But due to some reasons, due to some causes, there will be what? Collapse in the lungs. Let's see what are the types. Based on the causes which causes this collapse, there are three types of atelectasis. They are, the first one is resorption, second one is compression, and the third one is contraction. Among these three, the first two, the resorption and compression, are reversible. But the third type, the contraction, is irreversible. Keep this in mind, okay? When we get to know what is the reason for this contraction, you will get to know that why it is irreversible, okay? Now, the first type, resorption. When there is complete obstruction in the airway, there is going to be reduced oxygenation in the lung. So the type is called as resorption. And the reasons for by which there is complete obstruction is that there can be presence of foreign bodies, tumors, mucus plugs. What is mucus plugs? Mucus plugs are nothing but mucus aggregation in the lungs. Mucus aggregation in the lungs. Note this point, okay? And the mucus aggregation gets aggregated in cases like bronchial asthma, and there are some other cases also. When we discuss that, you will get to know, okay? Note this point. Then, when there is exudates in bronchi, in which conditions exudates are present in bronchi? In bronchial asthma, and in cases like bronchiectasis, and in cases like bronchiectasis. Note this point, okay? In bronchial asthma and bronchiectasis. So this is the picture depiction for this. Look here, there is obstruction. Due to this obstruction, there is collapse in the lungs, okay? The next one is compression. There must be something to cause compression in the lungs. They are fluid, air, and tumors. If these three are present in the pleura, it will push the lungs inwards. Look at this picture. So this is the place called as pleural cavity. In this, there may be presence of fluid, there may be presence of air, there may be presence of tumors, which leads to pushing of lungs. As a result of this, the expanded area of lungs will decrease. The expanded area is nothing but here. The expanded area of lungs will decrease. There will be collapse, right? Yes, the compression is done. Next, contraction. In contraction, there will be lung fibrosis. It is caused due to lung fibrosis. Okay? There will be fibrosis of lungs, due to which contractions will be there. Collapse of lung will take place. Right? Understood? As a result of all these three types of atelectasis, what happens is that there will be decreased oxygenation in the lungs. Very important point. Note it. And it predisposes to infection. They will be very easily prone to infection. Thank you. And for further more videos, subscribe to the channel.